the cloud. All right, well, welcome once again to another video podcast. This is Robert Wolf with Terra Firma Business and Financial Consultants. As you are well aware, I'm an asset coach and a tax strategist. And the whole idea and the goal of this podcast is to disseminate and share information to you, the viewer. Whether you're doing research for tax planning, real estate investing, retirement planning, or you're just doing research and for things outside of it, you know that the information I'm going to bring to you is information that is really just education in nature to help you, give you the opportunity to find the results or the answers to questions that you have, or at least help you to understand what questions you need to ask so you can get the information. And you know that I like to bring on people from all over the walks of life that bring special gifts and talents that maybe this will be something that will help you, or maybe it'll help a colleague or a friend, family member in a direction that will guide them to the answers that they're looking for as well. So today's guest, I have a very accomplished physician who is not just a physician. And doctor, I apologize. I'm sure I'm not the first person who's going to say this or the last, but I don't want to butcher your name, so I'm going to say it as best as I can. And then when I bring you on, you correct me after I read your bio, if that's okay.
Sure.
So I have Dr. Uli Chettipally. He's a physician, researcher, author, and an innovator. He's held several leadership positions while practicing emergency medicine and conducting research as a physician scientist interested in technology-enabled care. As the Chief Technology Officer of CREST Network, he designed, developed, and implemented a region-wide clinical decision support platform to deliver real-time predictive analytics at the point of care. He also received the Pioneer Award for Innovation from Kaiser Permanente and the Morris F. Cullen Research Award from the Permanente Medical Group. His other roles, like you need more things to do, right? His other roles include President-elect at San Mateo County Medical Association, Chairman of the Society of Physician Entrepreneurs in San Francisco Bay Area chapter, an advisor, mentor, and investor at various healthcare startups, which that I'm really intrigued about talking about. And he also has a published book called Punish the Machine, The Promise of Artificial Intelligence in Healthcare, which is available on Amazon as well. So, Doctor, welcome.
Thank you. Thank you for having me, Robert. It's a pleasure to be here. By the way, you pronounced my name perfectly well, so I am not.
Oh, nice.
You have that rare talent.
Thank you so much. So okay, so let's start this off. So you're extremely accomplished, obviously, based on your bio, and but there's one thing that on this page, what I was reading your bio, that just jumped off at me, and I wanted a little better clarification of what we mean by real-time predictive analytics at the point of care.
Okay. Predictive analytics, let's see. So if you normally go to a doctor's office, all right, with a problem, or you go to the emergency or a hospital with a problem. Let's say you sprained your ankle and you go to the doctor's office, the doctor will shoot an x-ray maybe, and then look at it and say, well, good news is there's no fracture, but the bad news is you have an ankle sprain. And so here are the few things that you need to do, which is number one, take some pain medicine, maybe apply an ACE bandage around it, to put some pressure, maybe give you crutches to help you, walk, don't put any weight on it, put some ice packs and keep it elevated. Right? That's the standard treatment that most people know that they should do if they have an ankle sprain, and then that's what the doctor will recommend.
Right.
And this has been the treatment for, maybe ages, right? We know that Our grandparents, parents probably did the same thing. And the question is, is it really the right treatment? Do we need to put ice, or maybe we should put heat, or maybe we should not put anything? Should we rest the ankle, or maybe we should walk on it? Maybe it'll heal faster. We don't know, because there was no research done into that area that showed that, okay, you have to put, this medicine, or you take these pills, and which pills are better, and whether you should take pills or not. Maybe you should bear the pain. Maybe it'll get better faster. We have no idea, right? And all the research comes from, the big academic medical centers. And the big academic medical centers are based on, what research gets funded. So let's say there is a big undertaking by the National Institute of Health, and they say, okay, this time or this year we'll stress more on, let's say, hepatitis C infection or something like that. Or maybe the pharma will come up with funding for, let's say, cancer of the pancreas. So that gets funded, and so that's what the research goes into. Nobody will fund a research into ankle sprains.
Right.
And probably 80% of what we do, prescribe and treat and advise, does not have a solid research backing. But we do a lot of things, and a lot of procedures, a lot of operations, and a lot of things. But we don't have a solid knowledge that, okay, this is exactly what you should do for a specific patient. Maybe for each patient it may be a different treatment, but we don't know what kind of patient will be helped by this specific treatment. For example, high blood pressure, right? There may be tons of different kinds of high blood pressure medicines, high blood pressure treatments. How do we know which medicine works for which patient? Right? There's not much research behind it. We know that it works in some people, and some medicines don't work. But how do we decide which ones to try first? Should we do a trial and error and until we find the right medicine? So that's the kind of research what I do. What I do is I go back in time. Let's say I'll look at 100,000 ankle sprains, right? A physician may have seen maybe 1,000 ankle sprains in his lifetime. But what if we looked at 100,000 ankle sprains and see what was done, and see which ones recovered and which ones bounced back to the doctor's office? Hey, this is not better. Or should we do an X-ray on every ankle sprain? We don't know, right? There may be some signs where it says that, okay, you should do an X-ray, because every time you do a test like an X-ray or a CT scan, it is radiation, and that is, there is risk of radiation to the patient. So is the risk worth taking? And is there benefit? So those are the kinds of questions I ask. Of course, ankle sprain is a simple example, but I'm talking about complex questions like, if you have chest pain, what are the chances of this being a heart attack?
Right.
Depending on the type of patient, depending on their risk factors, depending on how they show up in the emergency department. And so those are the kinds of studies I design. And that's where technology helps. Technology is able to take these large amounts of data and come up with predictions. So that is what is predictive analytics is. And then doing that at the point of care means while you're seeing the patient, if you have that information, you'll be able to make a much better decision for the patient. So that's the gist of my work, what I do.
So I would guess, which sounds extremely interesting, because I would guess as a emergency physician, you probably saw a lot of crazy things that we can only imagine or see on TV, right? That would cause you to think like this. Because as a scientist, well, you can make the argument that every physician's a scientist at some level. You're actually taking it the next step to say, as a physician, I can provide even better care if I use all of our past experience and use all that research to say, okay, use your example, ankle sprain, you know what, based on somebody in with your dynamics. So let's say, you know, their height, weight, blood, or whatever the case may be, most people in athletic, male, and based on this situation, this is the type of treatment that that ankle sprain can be healed in 50% quicker.
Exactly. You got the point. That's exactly what we're trying to do. And also, you know, there may be a lot of unnecessary testing, unnecessary treatment that we may not know that it doesn't work, but we've been doing that for so many years that, it's hard to change practice, right? So
yeah.
Now technology is at a stage where it can go through this huge amount of data and come up with, what is working and what is not working. The machine learning tools nowadays are very powerful and be able to give us that answer very quickly.
Yeah. So yeah, because when you think about it, most of the time when you go to the doctor, they'll order labs or certain type of treatment. All that has a dollar amount behind it, right? There's a cost associated with that. And that cost associated with that is for you as a physician to figure out, how do I treat that patient better? And so when we're talking about healthcare costs rising, this seems like a very logical way. I say logical because you thought of it and you've explained it very well. So now obviously it's logical because now I understand it. But a very logical way to drive down those costs of healthcare, and from a global perspective as well, because not only are you driving down unnecessary costs from treatments and stuff, but you're also, from a patient perspective, they're healing quicker. So the outside, what I look at this from my perspective is, now that patient can go back to work quicker. They can be more productive at work, whatever they do. And so the cost to the employer or their own business now starts to drop as well, because now that person can be more productive because they've been able to heal at a more rapid pace, or not even a rapid pace, more efficient, right? Now we're allowing their body in the treatment to take the most efficient pathway to heal.
Exactly. I think you got the point. But cost and time are just two factors. There are many more factors that'll be affected, by using this way of thinking. Number one, let's say you have hypertension, and pretty serious hypertension. We know that you don't have any symptoms, but we also know that this hypertension is increasing your risk of having a stroke 10 years from now. So if we start to, trying to find, the right medicine, it may take 6 months, it may take 1 year to find the right dosage, the right medicine for your particular type of hypertension. Now, is there a cost to that? Of course, you're prescribing a medicine that may not be effective. That's monetary cost. But there's also your risk of having a stroke is increasing with each day that your hypertension is not treated. That's number one. Number two, when you order tests, if not all tests are the same, and tests are not, 100% accurate, in the sense that it depends, a test's value depends on several factors. How great a test is it? What is the sensitivity? What is the specificity? What is the prevalence of the disease being tested? If the disease that you're testing is so rare, the chances of having a false positive test are much more than a real positive test, when you do that. So all those factors are associated with testing, which means that a bad test, well, I'm calling it bad, but it's a good test, but
Yeah, right.
used in the wrong way. And that test can eventually lead to wrong diagnosis, wrong treatments, maybe wrong procedures even, right? You might think that, oh, this test showed this, so maybe I'm having a bad disease, and so I need to have this operation now. So that is, that's the downstream effect of testing. And then, maybe they'll say, oh, you have a serious condition, you need to stay in the hospital. Well, hospital not only is expensive, but there are other associated risks with hospitalization. Number one, hospital-acquired infections. Number two, medical errors, getting the wrong treatment or wrong surgery or wrong something happening wrong are higher in the hospital, right? Compared to not being in the hospital. And then you have these other psychosocial effects of being in the hospital. It'll cause depression, it'll cause, anxiety, it'll cause all kinds of things where people who have been to the hospital are experiencing once they come out. And so you avoid a lot of those unnecessary things.
Yeah, it's interesting because I think back to my grandparents when they had to spend time in the hospital as they were aging, and what's interesting is that there's already a fear of being in the hospital, especially I think as you get older, because the mental aspect of time, right, is starting to change. And so when you are in a hospital, you already know you're sick or ill, or you have some kind of some reason why you're there, and it causes your other emotional and physical reactions as well. And what's interesting though about it, as you're talking and as I'm thinking about this, you don't even have to be somebody who's aging, because I think about it like when I've gone on vacation, right? You're going someplace where you're enjoying yourself, right? It's fun, you're doing stuff, but there's nothing like being at home in your own bed, in your own environment, your own controlled atmosphere that is yours and that you can say is yours. So even as, I'm 44, so even as a 44-year-old coming from having a great time for a week, just being at home in my own bed is just so satisfying, right?
Yeah.
And all these positive emotions flow. So then you translate it to a health situation, an age, a hospital. There's a lot of situations that cause that undue stress, right?
Yeah.
And as a physician, I can see how it would be a struggle, because now you've completely left the baseline of that patient. Because the baseline at home and healthy is now different while they're in the hospital, and so they're having physical, emotional reactions to be in the hospital. Do you treat that, or do you treat the core ailment or why they're there, or do you treat both? And how do you do that? That's very intriguing to me as a patient, future patient, or current patient, whatever you want to call me. Because those are situations that, how do you develop treatment for that? That's very, very, and I can see how you can use technology, because you have that bandwidth with technology, be able to take all that data and to crunch the most efficient aspect at the point of care, what you're talking about.
Yeah, and so psychosocial effects of hospitalization are pretty huge. People go into depression because they think they're really sick, and you're isolated because all your friends can't be there, or your whatever your social setting, your family can't be there all the time. And then the light in the hospital changes, the constant noise in the hospital, the sleep cycle gets disrupted. And so I mean it does have a very detrimental effect on your psychosocial health and the mental health. And people go into delirium because of medication or upset cycle, especially the elderly. They face a lot of challenges. And now there is enough technology to be able to understand, is hospitalization really necessary if it is just getting IV antibiotics, can they do it at home? Can you monitor people from home, using their cell phones or Apple Watch? And so those are the kinds of things we start to think, once you realize, what technology can do in these days.
Yeah, that's interesting. So, as we're going through this conversation and learning more about how and what you do and looking for the efficiency of treating patients and using the environment and the information that you have, I always try when I'm on these calls is try to figure out what that individual is doing, what you're doing, and how does that relate to what I'm doing for my clients. I almost said patients. For my clients and prospects. And the reality is that what we should be trying to do as professionals is try to provide the most efficient outcome with the least amount of stress. And I use the term stress just because I don't know a better word at the moment, but it's not necessarily that it's a negative thing, but it does create that push-pull effect that causes us to be out of our norm. And so, like when I'm sitting with let's say like a business owner, whether they're a physician who owns their own practice or a business owner who makes widgets for other companies, the reality of it is that they have certain constraints that they have to deal with just in their normal environment. Now you put on somebody like myself who's come to try to help them in their financial situation, whether it's reduce taxes or increase their wealth through different avenues and assets that they have, or just teach them about what they have, right? I like what you're doing. I find that teaching people, understanding the various aspects that we have, the data, and how we can use the data to create this efficient outcome, most people don't know what I know.
Yeah.
They may know a portion of it, but they don't know all that I know because I am me. And it's funny. I used to tell people that are pregnant, that are reading books about how to raise children, that kind of stuff. And I always tell them, I said, those books are very informative, but the reality is, the moment you have your child, all those books go out the door and you start writing your own. Right? Because we're all different. Yeah, and it's good information to have and to see how people have treated certain situations. But the reality is that what we're doing right now is different, and that's what I like about what you're doing, though, is you're trying to gather all this data and all this information, and trying to create this outcome that could be beneficial to us. So let me ask you, as an emergency medicine physician, you're probably you're working in the ER or wherever you were working at the time, and at what point did you realize, hey, there's something I can do. I can make this entire process better. What was that like? At what point did that happen?
Well, so around 2005 or so, what happened was, I've worked in the administration. I've been the assistant chief of the department. I've been the chairman of the department by that time. And, we were looking at outcomes, how can we make this better? How can we make patients feel healthier sooner? And those questions were in my mind. But then around 2005, what happened was that we implemented the electronic health record, where we went from paper, to computer-based records for patients. And so we had to enter all this information, and we became, in a couple of years, we became totally paperless. That means that everything that we know about these patients will be in the computer. And then I started thinking, was around 2009 or 10, is, we have this wealth of information. I wonder what we can gain from it. It was just a curiosity that I wanted to see. Sometimes you're asked to do certain things by, whether it's your professional association, these are the, guidelines that you should do to patients and things like that. But in your own personal experience, that, you can start to question, does this really make a difference? Does this really help the outcome? And then those are the kinds of questions I was having when I looked at those guidelines. And I said, hey, you know, we have access to these thousands of records. Maybe these records can show us, you know, whether, you know, doing A versus B, you know, which one is better, or whether to do it at all or not. And so that was my curiosity. And then, you know, I had another colleague of mine that was working at another hospital, and then we both got together. We were both curious in that sense, and we both had applied for a research grant in the same area, in stroke research. And then we got together. I didn't know him before that. And so we got together and said, hey, you know, why don't we join hands and figure this thing out? And that's how, you know, the whole concept of a research network started. Just the two of us, we were the co-founders. He was good at writing grants and I was good at technology. And so we said, okay, let's do this. And that group grew to 14 physician scientists who were all working on different things. And we published about 100 papers out of that research.
Wow. That's amazing. You know, it's when I work with clients, one of the things I always try to do is I create what I call strategy layering. And the basics of that is what I'm trying to do is take two separate assets and I'm trying to buddy them up. And I call it the asset buddy system. And your explanation of how you guys have been able to go from just you to now 2 people to now you have 13 other physicians all researching, doing stuff, is exactly what I teach people about assets. Is that, you know, when you're able to take one asset and combine it with another, the amount of efficiency of growth of information becomes exponential. And I always use the silly analogy is when we were kids, right? We always had our favorite toy that we played with. And we could probably play in the front yard or room or the backyard by ourselves for a couple hours and just be completely satisfied. But the moment our best friend came over and started playing with us, right, all of a sudden the storyline and the game and everything just expanded, and all of a sudden the whole day goes by and you didn't even realize it because you're just having so much fun. Yeah. And that's essentially what you guys have done, is that you guys took the two minds, the two areas that you both had great gifts at, combined them, and became this process of being scientists, if you will, became much more efficient. And because of that, other physicians saw that, whether you reached out to them or they reached out to you, either way did not matter because they're with you. And they saw the efficiency and the ability to where if we can combine our efforts, now our abilities to look for this outcome becomes even more exponential and becomes more efficient. And I love that you shared that with me, because it's so important, because at least in the finance world, okay, whether it's retirement planning or real estate investing, we do a horrible job or a great job, whichever way you want to view it, of siloing everything. Everything, it's in its own little silo. Yeah. And the problem for you and I as humans that own these assets, we're not getting these assets to work efficiently, other than me trying to figure out how to make that happen, me as the individual. And it's not possible. It's not possible. They have to work together to become the most efficient benefit to you as the individual. And so I appreciate you sharing that, because it's amazing, because that message is not just for you. That message is not just for me. This is a message for everybody, that as a human, we belong together. We belong together because we're better together than we are separate. And so talk to me about your book. So, Punish the Machine, The Promise of Artificial Intelligence in Healthcare. My guess, I'm going to go on the limb here, my guess is that it has something to do with what you shared with me.
Yes. So that's, as the group grew from 2 people to 4 people to 6, and then I started realizing is that in order for us to be able to do this research I have to build a platform, a technology platform that can collect data from the electronic health record, that can pull the data from the situation on the day of the visit, which is the emergency department, the vital signs, the lab tests, the x-rays, and also collect the data from the patient or the physician who is interviewing the patient. So bring all this data together and analyze it, and then be able to give an answer to the physician, helping them make decisions on the care that they're providing to that patient on that day at that particular time. So I built this whole system. That's my claim to fame, is that I built the system which is now active in 21 hospitals and is able to process about 1 million patients a year that go through the emergency departments and analyze this kind of stuff. So there are several modules built on top for, let's say, for heart attacks, for strokes, for congestive heart failure, for atrial fibrillation, for belly pains, for head injuries, and things like that. And so we are able to study each of these disease entities and come up with the most efficient data-backed decisions for the physicians. And so we have built a very nice system. And then I realized, what if the system can continuously keep studying itself, which is what machine learning does and artificial intelligence does. And that's where I started exploring that more, understanding that more, learning more about it, and also testing it out. And that's the result. The book is the result of all that work that I've done in this area. And I see a big role for machine learning and artificial intelligence in healthcare in the future. Is where you can make the right decisions.
So the 21 hospitals that use your platform, obviously you're looking to expand that, right? And because the premise is the more data, the more predictive the results can be, right? If data is king. And so are these 21 hospitals throughout the country, or are they just regional as of right now, or share with me about that?
So this was with a company called Kaiser Permanente, which is, in a few states. But the group that I was working with is in Northern California. So these 21 hospitals are in Northern California. By the way,
okay, great.
I took early retirement from the group, so I'm not with them anymore. So starting this year, I started my own company, and I'm doing consulting, which is the Innovator MD brand. And I help, startups, I help large companies trying to figure out, how to do this thing at scale.
Nice. Well, it's funny because when some of the awards you won from Kaiser and what you've shared with us thus far, a lot of it sounded very Kaiser-esque, if you will.
Yes.
Because that's Kaiser's mission really does seem to be very focused on, and of course all hospitals and the healthcare industry as a whole is really trying to strive this direction. But it really seems like Kaiser's model has already been built in with what you're able to provide. Seemed to be a good fit. It almost seemed like you were born to work in the Kaiser model to start building this, and then you did it, right? And it's working great, and obviously it's continuing to evolve, because that's what technology and humans do, as we evolve. And so now you're out in the consulting world with the Innovator MD, and so talk to me about being a consultant, sharing this mindset that you have with these other very excited young or even older people who want to start these businesses to kind of follow that pathway, or even lead their own pathway, but utilize your expertise. Share with me that experience that you're having.
So I started this company this year, early this year, and it's been a fun ride. One of the things that, And you're right, Kaiser Permanente is perfect, for this kind of approach, using technology to improve care. And the reason for that is it's the business model. The business model of Kaiser and a few other companies is called value-based care. Value-based care, as a broad term, means that you are the business model is where you generate income or make money for the company when you keep the patients healthy. So you get a fixed amount of money to take care of patients, right? And if you keep them healthy and out of the hospital and keep their expenses low, then, and of course the quality is good, then you make money. Whereas about 70% of the rest of the country, is in the fee-for-service mode or fee-for-service business model. In the fee-for-service business model, which is exactly the opposite of value-based care, you make money when the patient, does clinic visits, does tests, does hospitalizations, so you make money when the patient is sick, in other words. And the costs keep going up, right? Obviously, if you keep, if you incentivize people to do tests or to do operations or to do hospitalization, they'll keep doing that. And there has been a tremendous pressure on these companies to change their ways and decrease the cost of care overall. And so they're all trying to figure out how to switch to value-based care. Now, you can't switch to value-based care so easily. I mean, obviously, it's exactly the opposite of business model. So in order to do that, you will need a lot of help from technology. You need those analytics. You need to look at those numbers, and you need to change practices. So the whole culture has to change. And the whole business model is changing. And so you need good analytics and good technology tools to be able to do that. And that's where my expertise is useful, where companies are trying to switch from fee-for-service to value-based care. How do you do that? How do you manage a population? How do you decrease the risk of a whole population? Because if you decrease the risks of the population, then you'll have less bad outcomes like strokes or heart attacks or cancer, 5-10 years in the future. But you got to take action now. And what are those steps that you need to take now to be able to decrease that risk in the future? And that's how you bring down the cost of delivering care. So that's my expertise.
Interesting. So yeah, because I work with a lot of health insurance brokers, and one of the things that they talk about within the insurance carriers and coverages is wellness, right? Wellness care, go get a checkup and you can get a reimbursement for the checkup. Is, cancer policies, go get a cancer screening, you can get a reimbursement from the company for doing your cancer screening. And they're being incentivized as a patient to stay or become healthy by being incentivized with a dollar amount, right? And a reimbursement. So I'm paying premium for this particular coverage, but if I go get this screening, I can actually get some of my premium back because I did this screening. And the reality is that it's kind of like, when you're raising kids, right? Do what I tell you to do. I'll give you a cookie when you do it. Right? So it's a hard model to get out of because like I just shared the example as kids, that's how sometimes we raise our kids, or you see other people raise your kids.
That's human nature.
It is, right? and it's the opposite of fight or flight, right? Fight or flight is a fear. That here we're talking about more positive things. We're going to get something, there's a positive emotion or joy that's going to happen. And so it's interesting because I think these two models, this value-based care and this fee-for-service care, I see with technology and what you're doing and a lot of the things you read in some of the medical journals, that we're starting to see a blend. right? And that's something that has to happen. But to your point, it could only happen with the ability to have technology to take all this information to prove why it needs to be, why both are good in their own right, but they can be even better if we were to combine them into a shared model of some sort. And that's going to take some time, I would imagine.
Yes, there needs to be a willingness of the leadership, to change. There needs to be a full change in culture, and then of course, technology. They need to invest in technology to be able to, look at those variables and be able to change, predict and change the outcomes.
Yeah, interesting. Well, I'm a total geek, and I could probably talk literally all day with you about this, because I have a lot of physicians that I work with that are clients of mine, and I hear from them how medicine has changed. Of course, the big thing is physician burnout. We hear a lot of times about, and that's where I come in a lot of times, where I'm able to at least take, I had a retired surgeon share with me. She said, look, Bob, most physicians don't think about money. They didn't get into medicine for money. They got into medicine to care for people. And so they do get paid well, and depending on their specialty, depends on if they get paid more or less. And she said, but we rarely think about money. So then you have the rest of the world that thinks about money, and they come to us as physicians who make about money, and you're going to tell us you're going to help us grow our money, but we don't care about that. That's not even a thought in our mind. And so it's interesting, though, because almost every single physician I work with, though, has a concern about their finances from the standpoint that, okay, their finances are essentially their exit strategy out of medicine if that's ever a need. It's almost like a safety net. Right?
Yeah.
And I want to make sure it's there. And so, but if you think about it, as humans, we can only have so much in our head. And if I'm worried about, the healthcare changing the way it has been changing, and I'm a physician that I'm looking for my safety net, but I don't know what to do with my money. I don't know what to do with my assets. I have 4 or 5 houses that I've been able to grow, and I don't have the time to deal with that, right? I thought it was fun, but then I got busier. And then I have all these other things that are tagging, and they're all kind of pulling at the mind strings, right? So I see a lot of what you're doing is trying to improve care and create predictive models to help the physician be more efficient, which is some of what I do on the finance side, because my goal is to take that thought process out of physicians' mind. I want them to feel comfortable, okay, somebody's taking care of it. They're dealing with all the various people that have to be dealt with to get my safety net. Now I can spend more time with my patients, and I can be a better physician helping my patients. And when I help my patients, we as a community become healthier. We become more joyful when we're healthy, right? We tend to have more of a smile when we're healthy than when we're not. And because, like we said earlier, we are all humans, so we all belong to each other some way. We are better that way. I find this very, very intriguing. And like I said, I could probably have a conversation with you for all day. But I doubt a viewer would want to be on this call for 5 hours. So I would be happy with it. So one of the things I would say is, if I can close this up, unless there's any added thing that you want to share with us, feel free to do that. And if not, then I'd like to close this up with a couple thoughts.
Yes, I wanted to, of course, you already talked about my book, but I'm hosting a conference in San Francisco. The website is igs2020.com. Innovator MD Global Summit, igs2020.com. And it's all about, these physicians and in various places of the world, and even in the US, they're working on these unique, brilliant ideas. And I want to bring all those ideas onto a platform and be able to disseminate them. The innovation that physicians are doing, they are working hard, and I want to create that platform. So I would like to invite your listeners to that conference in January 2020.
Well, thank you. I appreciate that on behalf of them. I think that's fantastic. What a great opportunity to kind of bring all these mind trusts. Kind of how you got started, right?
Exactly.
You and another gentleman got together, and all of a sudden
bringing it all together. That's right.
Yeah, I think that's fantastic. Thank you. So, and then of course, go on to Amazon and purchase his book, Punish the Machine, or you can go to punishthemachine.com and to learn a little bit more about if this is something that you're interested in being involved in, right? And or if you're just interested in how can you as an individual be part of this innovation, even if you're not an innovator, right? Even if you're like me, where I know how to turn on my computer, I know how to do my daily tasks, but I couldn't tell you how it's working.
Well, I mean, one of the things that physicians will face is that, this technology is coming, and it's better for them to learn about it and figure out how to deal with it and how to use it, for their own advantage, right? Technology is coming and the change is coming, and I don't want physicians to get scared of change or get burnt out because they're not prepared for it. So that is one of the reasons why I wrote the book, and also I do these conferences.
Well, that's fabulous. Thank you. So again, thank you so much for your time. I really appreciate it. This was, like I said before already, this was very intriguing to me. And for you, the listeners, I appreciate you spending the time investing with us to learn a little bit more. And if you weren't, if you have anybody that you're curious about that is looking at other areas, or even your own physician, and you think there's areas that your own physician needs to improve on in their practice, I don't see a problem with purchasing the book and giving it to your physician as a gift, and and I don't think that would be considered a negative. I think that would be considered a positive, because though it may be, who knows, right? It's all about personality. But I think you're right. The change is happening. And it's happening. It's happening in my business as well. And I'm looking at certain people, and in certain areas of my industry, and you can see that there are some people who are not. They still have their head in the sand, I guess, is use that term. Exactly. And you can only do so much. But so, Doctor, I really appreciate your time. I think this was fabulous. I thought this was a lot of fun. Once again, thanks for attending. This is Robert Wolf with Terra Firma Business and Financial Consultants, and an asset coach and a tax strategist. And if you have any questions about what we can do from a tax savings or retirement savings or anything like that, anything I had mentioned during this conversation, or if you want to reach out to the good doctor and you want to have some kind of introduction, because you want to use this as the guiding introduction to learn more about Dr. Chettipally's research and how you can be involved, feel free to reach out to me, or you can go to his website, like we said, innovatormd.com. And thank you so much for attending, and I look forward to seeing and hearing from you in the future.
Thank you, Robert. Thank you, listeners.